My name is Frank Gregolite. I'm the APP at WVU in the ECMO program. So with ECMO, first thing is you want to know what it stands for. I mean, that's your extracorporeal membrane oxygenation. So we just use ECMO for short. It's just not something that's easily rolling off the tongue. So with that, it is a life-saving technique that is actually for those severely critically ill in whether it's respiratory, whether it's cardio or it's cardiorespiratory failure. And it's a temporary procedure that's used to kind of get you through to where we can actually manage the majority of the disease. So the basics to it are, at its core, it acts as a mimic to your heart and lungs. So what it does is, through its circuit that it's by design, you can actually rest the lungs, you can rest the heart, you can rest them both. And it's done through basically three parts. So you've got your cannulas that allow to be connected to the patient for blood withdrawal and putback. And what you're doing is you're oxygenating it through an oxygenator. So that would be the second part. You've got your cannulas to get the blood. You'll use the oxygenator as the second part. And then what you do is you have a pump that allows continuous circulation of that blood. So with that system setup, you can withdraw the blood, oxygenate it, remove the carbon dioxide, put it back into the patient. The biggest thing is when you're looking at what it does, then it becomes what are the applications for it. So if you have lung issues, we can use it for that. If you have heart issues, we can use it for that. So cardio and pulmonary, we can do it for both. So the two types of ECMO are you're looking at VV and VA. And with VV, it's veno-venous. And with that type of setup, you're focused primarily on the lungs. When you're in VA ECMO, it actually helps with the heart and the lungs. So that would be your venous arterial. So with VV ECMO, what you're looking at is resting the lungs primarily. With VA ECMO, you're working on the heart and the lungs, or just the heart. The lungs could be fine in that situation. So the applications become if, for instance, you have cardiac failure. With cardiac failure, ECMO provides that temporary life support for you to actually get the cardiac output that you need to the point where there's either a transplant, or if there is surgery that can be done, or if you're just trying to recover it. If you have something like respiratory failure, then you're looking at ARDS, injury, traumatic injury. You're trying to rest the lungs. So what you do is you would do VV ECMO for that situation to allow the lungs to rest. The heart's fine. If in this instance that you have cardiorespiratory failure, you would be on VA ECMO and you rest both of them until normal function can be restored. Meanwhile, treating any other underlying condition that you can, because ECMO has provided that to you to allow to do. The other thing to look at are the benefits of ECMO. So when you're looking at the benefits, it is a life-saving routine. It's one of those things where it can do the bridge to transplant. It can do resting organs to allow you to have them heal from whatever caused it. It actually improves survival and outcomes. So what it does for a patient that is critically ill, it provides them a chance where conventional therapy hasn't done the job or is having trouble. It allows it to come in and give that extra lifeline to the patient. The other thing that it provides is enhanced healing. So you can get rid of infection through medications, you can do different things in ICUs and settings, but what ECMO does is it allows you to actually rest the organ that you're trying to heal. And again, you're constantly through those components helping oxygenate, even if you're not using the lungs, even if you're resting the heart. So with ECMO, there's always going to be some risks. And just like any procedure, you're going to have some risk associated with it. Obviously, there's a risk of death. You know, you do have to address it because you're actually putting someone on such a life supportive measure. You're taking things away from them, and hopefully they do heal. There are some indications for it, more specific than contraindications, and it's very relative. But you're at an increased risk of bleeding, you're at an increased risk of infection, you're at an increased risk of deconditioning and things that you don't necessarily think about. You're at an increased risk of nerve issues to where there could be some lingering, numbness and tingling. But for the most part, the risks are outweighed by the benefits.